I was going to have a special guest to come and talk today, but unfortunately he couldn't make it. So I'm going to see if I can successfully, for just the next few minutes, channel my friend Elmer. Now, Elmer he's been a friend for a good long while, and he and I work together. He's a rural Kentuckian from our county, Kentucky. Probably many of you who have rural connections will recognize Elmer with no problem at all. So give me just a second here. Let me see if I can get to that. Hi, y'all. I'm Elmer. Like the doc said, I'm from our county, Kentucky. He asked me to help him out this morning, and of course I try to accommodate him any way I can. But this story that he wants me to share with you really started with an article in our own newspaper, the Inside Scooper. It's been quite a while now, but they put out an article about the health of our county. And so, of course, we all read our local newspaper, and man, when we started reading this article, we were a lot of surprises. We learned, for example, that our country ranks pretty low in the rest of the industrialized world in terms of our health status. Further, we learned that our state, Kentucky, ranks well below most of the other states in terms of our health in the United States. And then, lo and behold, it turns out that our county ranks way below most of the counties in Kentucky. It was just a shocker, you know. Man, the people in our county are fat, they're lazy, they're dumb, you know, they don't even graduate from high school, they're poor, oh, we knew that. They smoke too much, they chew too much, they eat too many Big Macs, you know, they drink too much pot, and all the time their kids are playing around watching television and smoking and dropping out of school. Man, you know, there's something wrong here. This is not the way we want to be, as my grandson says. What the heck? You know, this is definitely not okay. So we just started wondering, man, are we just a sorry bunch of rednecks or what? You know, what's going on here in our county? So we really got quite interested in this whole issue, and some of us were sitting around at Uncle Ralph's restaurant having a cup of coffee and talking about this, and we started studying about, now, you know, who's in charge here? Why are things like this? You know, what in the world can we do to make things better? So we decided to divide up the territory, and we go around and talk to people who know the answer to some of those questions. So one of us was in the health department. Makes sense, right? I don't know all about this whole thing. And so we started asking these questions about our health, who's in charge, and all that. And they said, well, gosh, you know, we really do a lot of things. You know, we do a lot of stuff. We don't know how well it works, but we sure do a lot of things. Besides that, we are really busy with stuff that we have to do. So good luck to you, and let us know where to find that. And somebody went to the hospital and asked about these same questions. And they said, well, yeah, what we do is we take care of emergencies. We take care of sick people when they come into our door. We're not much into this stuff of keeping people well. Several of us actually talked to our doctors, and they said, well, you know, there's probably nothing that can't be fixed if we can just get a partner in our practice. But then, you know, I was lucky. I went to talk to a school nurse, and it turns out she really gets it. She started talking about what healthcare ought to look like, what she's doing in the school, started helping kids be more healthy. And then she told us about this bunch called the Friedell Committee. And so that kind of got our attention, that this is a group of people from all over the state that thinks that we can make things better, maybe just in Kentucky and in our county, while we're trying to wait for Washington to get real. We actually were able then to get hold of Miss Carolyn here, who told us all about these principles and that they could teach us a little bit about what to expect of our healthcare system and some questions that we could ask to try to figure it out. And, you know, we all recognize that people have to change, but Friedell says, well, you know what, the community has to change too, because the community has to support people as they make changes themselves. So it's a big team effort, and the community has to be involved and help instead of hinder as people try to do things better. Well, we were really impressed. You know, we decided this Dr. Friedell must be really smart to think up all this good stuff. And then, you know, he uses a lot of really fancy words too. You know, he talks about transformation and affordability and responsibility and accountability and respect and quality and safety and all that sort of thing. But the bottom line is that it sounds like that the committee thinks that everybody can help to have better health, even people like us in our county. And we have certainly found out that when we look in our county at what is there, what we have, how it's working, and look at them in terms of this set of principles that Ms. Carolyn just told us about, is a real eye-opener. We just learned all kinds of things. We got interested in a lot of different things, you know, all the way from the county judge, the fiscal court, the extension office, all of these people in the community who really do have an interest in making us more healthy, okay? The business community, all these people. And then, of course, there's obviously the health department and the doctors in the hospital has to be a part of that too. But we really thought about this quite a bit, and we are totally convinced that we can figure out what's wrong using these principles, that we can figure out how to make it better. We can think of some changes. Because you know what, folks? It's obviously up to us in the community if we're going to make a difference in the health of our county. So we're going to take the point. We're going to try to get all of these people who ought to know the answers to join us with that. And not only fix the problems, but then use these principles to see how well it's working after we make some changes. And I'll tell you, we expect a lot more of our healthcare system now than we did before we started thinking about this. So, we'll let you know how it turns out. You know, it's going to be a while. It's a long road to hoe, and we've got a lot to do. But we'll be back to let you know how it turns out.